So here we have these brachiocephalic veins, the right and left, and they're going to merge and form the superior vena cava, just like we did on there. And then here you've got the inferior vena cava. All right? So the blood from the upper and lower extremities are going to be returned back to this right atrium. Okay? That's the chamber. This little wing-like portion is called the right auricle. Right? When we open that, this muscle is going to be called the pectinate muscle. Okay, pectinate. From the right atrium, well, actually, you see this little white depression. It's called the fossa ovalis. Okay. Remember, in the fetus, you have an opening between that called the foramen ovale, but here it closed, so it's fossa ovalis. Okay. From the right atrium, the blood's going to flow to the right ventricle, and it has to go through this valve called the tricuspid valve. Okay. Tricuspid valve has these little white strings. They're called chordae tendineae. All right. They're being anchored down by these muscles here called the papillary muscles. Okay, so pectinate is up here, and then these are the papillary muscles. Okay, got the right ventricle. Here you have these muscular ridges called the trabeculae carneae. Okay. All right, from the right ventricle, blood is going to pump to the lungs. Okay, so all of the next terms are going to start with the word pulmonary. Okay, so you're going to have a pulmonary semilunar valve, pulmonary trunk, which branches and forms the right and left pulmonary arteries. Okay, those pulmonary arteries are taking deoxygenated blood to the lungs where the gas exchange occurs, and then the oxygenated blood is returning via these pulmonary veins. Okay, pulmonary veins return it to the left atrium. Okay, from the left atrium, it has to pass through the bicuspid valve, or you can say mitral valve. Same thing, still has these chordae tendineae, and it's still being anchored down by these papillary muscles. Okay. Now the blood is going to be in the left ventricle. From the left ventricle, it has to pump to the aorta. So this valve back here, if you can see it, is the aortic semilunar valve. Okay. So aortic semilunar valve goes to the aorta. So we have ascending aorta, we've got the aortic arch, and then we have the beginning of the descending thoracic aorta. All right, our three branches, like we said before, we have A, our B is for our brachiocephalic, and notice all three brachiocephalics are next to each other. C is, this is going to be our left common carotid, and this is going to be our left subclavian. Okay, so brachiocephalic, left common carotid, left subclavian. Let's see. Okay, for the, and right here, ligamentum arteriosum. Right, remember in the fetus it's called ductus arteriosus, but here just ligamentum arteriosum. All right, so the conduction system, remember the pacemaker of the heart is the sinoatrial node, your SA node. That sends signals to this AV node, your atrioventricular node. All right, from there, it's going to go to the bundle of His. So in this model, you have your right branch of bundle of His and your left branch of bundle of His. And all these white fibers along here are called the Purkinje fibers. Okay? All right. Let's see, where it comes to a point right here is the apex, versus at its widest point, it's just the base. Let's see, here you can see where the azygos vein is returning back to the superior vena cava. Okay, so azygos. All right, now let's do our coronary circulation. So over here, you're gonna have this right coronary artery, okay? It's gonna give rise to this one called the marginal artery. So all of these, I always think of like the margin of a page, okay, to remember this name. So marginal artery. And then we're going to follow the right coronary artery all the way around. We're on the back side, so posterior, and it's in between the ventricles. So this is going to be the posterior interventricular branch, okay? So on the right side, we just have right coronary artery, marginal artery, and posterior interventricular branch, okay? On the left side, we're going to have this left coronary artery, and most of it is actually hidden because it's underneath the pulmonary trunk. Okay, so left coronary artery. It's going to split. So if it makes a C, it's coming around like this, it's going to be circumflex. Okay, circumflex. When it comes down here, we're on the front side, anterior, and we're in between the ventricles. So anterior interventricular branch. All right? So on the left side, left coronary artery, anterior interventricular, and circumflex. Okay, all of this. All right, for the veins, it's simplified. We're just going to have our great cardiac veins, okay? So on the left side, we're going to have this great cardiac vein. On the right side, we're going to have a small cardiac vein. And then when it's in the middle, just middle cardiac vein. Okay? So small, middle, and great cardiac veins all are going to drain into this coronary sinus. And then the coronary sinus is going to return the blood back to the right atrium. Okay? I think that's everything. I mean, you have the trachea and the esophagus, but I really doubt that they would ask that on, they're not going to ask that. That is everything. Here, I think they're going to ask it on the sheep's heart, but this big section right here is called the interventricular septum. But there's so much kind of going on in this area, I think they would ask it on the sheep, because you can see it really clearly. But I believe that's everything. So.